getting hormone replacement therapy, HRT, is a relatively straightforward process if you look like I was. It took a while, but it was pretty straightforward. The first thing I did was I'd been out for about 4 or 5 months maybe, and I decided, yeah, this is definitely kind of what I want to go for. I want to go talk. I want to get ahead just to make sure, if I do want to get surgery or whatever, because I was stupid at the time, then I can, just go ahead straight forward. So I went to my GP. I was very, very nervous, but my GP was just like, okay, like didn't question it all, just like, okay, this is how you feel. There you go. And I'm very lucky in that regard. Some doctors aren't as helpful, but if the first doctor isn't helpful, get a different one, keep trying. She said to me, actually, what, did you think I wouldn't believe you afterwards when I mentioned I'd been nervous? So I got referred to a specialist, a mental health specialist place, which is in a different city, which was fun. It took 6 months for a space to open up there. I had 3 appointments over the space of 4 months, I believe. From there, I was diagnosed with gender dysphoria, and I was referred to another mental health specialist who would be able to prescribe me hormone therapy. It took another 6 months for a space to open up there, and I had one appointment in which we discussed the various options I had ahead of me. I talked about this at the other clinic as well, but we went more in depth here because it was all about treatment, not really about diagnosing. And then after that, like my second appointment, after which I'd had about 3 months to decide what I wanted to do, because fertility options had to be thought about, and what treatments I wanted had to be talked about, and all that stuff. And after that, I got a prescription from my doctor, which took about a week, and then I got testosterone. So it was pretty straightforward for me, but I'm quite lucky in that regard. Not everyone is as fortunate, but I think once you get past the GP stage, it's a long wait, but you're pretty much good to go from there. Most of these places are pretty underfunded and, well, are very busy because they're pretty much the only place in the surrounding area where people can go, which is why the waiting lists are so long. But it's pretty straightforward once you get the ball rolling.